Cardiac sarcoidosis. Definition: sarcoidosis is a disease in which parts of the body develop granulomas, clumps of immune system cells responding to a perceived threat. Granulomas can interfere with normal organ function, causing symptoms that may be similar to those of other diseases. Cardiac sarcoidosis refers to the development of sarcoid granulomas in the heart muscle. This can affect the heart's ability to pump blood to the rest of the body with potentially life-threatening consequences. Applications in medicine. A diagnosis of cardiac sarcoidosis can be made in a few different ways. The first tests performed when cardiac sarcoidosis is suspected are an ECG and echocardiogram. Definitive diagnosis of cardiac involvement is made by endomyocardial heart biopsy. Diagnosis is often achieved instead by cardiac imaging with MRI, computed tomography, or more recently a nuclear medicine technique called positron emission tomography. Treatment of cardiac sarcoidosis includes fighting inflammation with immunosuppressant medication and managing functional consequences of the disease on the heart. Prednisone is commonly used along with other immunosuppressant drugs at doses high enough to be beneficial but low enough to minimize potential side effects. Pros and cons. The advantages and disadvantages. Advantages. Because of being a benign condition and a very good prognosis, it's a very treatable disease. It's totally asymptomatic, and in those who are symptomatic, it's about a year-long illness and then it goes away. Disadvantages. This is a fairly uncommon disease. It's difficult to see if a person has or not this disease because it has not specifically symptoms or signs. The treatment with corticosteroids is long, between 6 to 12 months, so there will not be an immediate cure. Issue applied in Ecuador. The disease is more commonly seen in young and middle-aged adults. In the USA, African Americans have a 3 to 4-fold greater risk for disease compared with whites. Estimates of the prevalence of sarcoidosis range from 10.9 per 100,000 population for whites to 35.5 per 100,000 for blacks in USA. In Europe, Scandinavians have one of the highest incidence rates at 50 and 60 cases per 100,000 population. In Japan, sarcoid heart disease is more common and responsible for as many as 85% of deaths from sarcoidosis. Because it's an uncommon disease, there are no statistics studies in Ecuador about it. And conclusion. Cardiac sarcoidosis is a disease in which the immune system is activated, causing the formation of clumps cells that disrupt the organization and function of the heart. This is a potentially dangerous condition which should be assessed for progression and severity and treated appropriately. Effective treatment can markedly improve outcomes and quality of life, though there is much room for further study to better understand the disease. Thank you.